And we are ready to go. All right, so today we're going to talk a little bit about detoxification. If you have questions, pipe in, just say, excuse me. Just say, whoa, stop, shut up, whatever you need to say, just say it because I can get rambling here. So if you have questions now, jump on right away before we get started. Otherwise, you can jump on throughout this thing. Anybody, anything?
Dr. Connors.
Yes?
This is Patrice. I have a couple questions, but they're not necessarily related to detoxification.
That's okay.
Okay. One is a possible infection.
So I didn't quite hear that.
The first question has to do with a possible infection in the lymph. Had this before, and I just am real anxious about it not happening again.
Okay, so hold on one second because I think your question was, is it possible to get an infection in the lymph? But
Yeah.
I can hardly hear you, and I don't know if other people are having, if somebody else can hear her real well, if you could repeat the question, that'd be great, but I don't know if it's your connection or something in the background. Was that the question, is it possible to get an infection in the lymph?
I know it is. I
There.
had one before.
Okay.
And I'm anxious that it not happen again.
Okay, so can you get an infection at the site of a tumor? Can you get an infection alongside of a tumor? Can you get an infection in the lymph system? Yes, yes, and yes. So is it a bad thing to get an infection? Usually, yes, it can be a bad thing. There has been instances that actually having a systemic infection can be a good thing. A local infection isn't always a good thing, isn't usually a good thing. If it's, let's say it's a breast tumor, so, and I have an increased redness and an increased heat at the tumor. Is that a good thing or a bad thing? Well, let's just kind of look at that physiologically. If I have an increased heat and redness at a tumor, it's most likely an inflammatory process. It's likely that it is an infection. It can be a bad thing because in infection can be will cause all these inflammatory cytokines to be present, and that can block lymph flow. So that's where it's really a bad thing, is blocking lymph flow. The possible positives of an infection is that an infection will spike an immune response. And that's, that can be ironically a good thing to the cancer because that can help kill off the cancer. I've had people literally go into remission by getting the flu. So it's like anything else when we talk about physiological processes. Be careful to label them good or bad always, because they're not always good and they're not always bad. It's not always good to get the flu when you got cancer and now you're completely wiped up and you're throwing up and you're losing weight. However, so as a cancer patient, I wouldn't go out and run and try to get infected by the flu, but it can be a positive physiological response. Long-term inflammation by a chronic infection is usually a bad thing. So if you got long-term inflammation, they're typically not the killer cells that you'd want, and it's just causing a ramped up, source of blockage. So that's not a good thing. So if you're trying to move lymph, I would look in your binder and look at the lymphatic exercises that you could do. There's a lot of other ones, but we did put some in your binders under the diet plan at the way back of the pages before the gut check. There's some lymphatic exercises. To kill an infection, you'd think of, antibiotics first. You'd think of also, the negative of antibiotics is it damages your gut flora. And so do I really want to use antibiotics? Well, in a situation that might be acute, maybe I would choose that. Otherwise, you're thinking of things like echinacea, golden seal, and garlic that are good kind of natural antibiotics, that those might be useful as well. Just a side note, when you ask a question, don't feel obligated to state your name, nor do you have to feel obligated to state what kind of cancer you have or what kind of disease you have. You can keep this as anonymous as you choose. So just so you know. Does that help then? Answer that question?
Yes, somewhat.
So I
How,
hate to be
how,
vague on that, but it's honestly it is kind of a vague answer. So
how do I determine whether it's systemic or not? I
well,
mean,
there's some clues. There's no possible way to determine any of these things for sure, but there's some clues. Do you have a fever?
no, I don't.
Okay, so that would give us a clue that it might not be systemic. If you're going to go the medical route, you would do a blood test. Do you have a spike in one of the white blood cells? Then that would give us an indication that you have an infection. Um, and then you got to go, okay, let's say if I did have an infection, then you go, is it bacterial or is it viral? Because if it's that viral, antibiotics aren't going to help at all. So it might be best to try to use some natural methods to begin with. If it's on an area on your body that you could try to do lymphatic exercises, like do cold, like an ice pack over the area, that might be good because that could help flush it out. You could, do some dry brushing. You could do some lymphatic exercises to try to get that moving.
Okay.
Any other questions? Okay, so we're going to talk about detoxification. So, what is detoxification? So, obviously, detoxification is getting things out of your body that are not supposed to be a part of your body. So, when we're dealing with any sort of serious disease, toxicity can be a component of the cause. As a matter of fact, one could maybe argue that toxicity is always a component of the cause. One could argue when you talk about cancer is that maybe the rise of cancer in the last 50 years has been, a good part to the amount of poisons that we're exposed to in our food supply and everywhere. I tell people that, the blue shirt that you're wearing wasn't dyed by blueberries, probably. It was dyed by chemicals. The carpet that you're standing on right now was made from chemicals. Everything in your house is made from chemicals, from the paint on the wall to, you know, everything that you're exposed to, and those are gasifying constantly. So you think of, you know, that a chemical. You think of it like, where does it go? So my paint faded on my wall. Well, where did the coloration go? Well, it gasified into the environment, and I breathed it in. It's where do those things go? Well, you breathe them in, or you swallow them, or you're exposed to them on your skin, and they get into your bloodstream, and then it's a foreign thing, so your liver tries to detoxify it. And if your liver is clogged because it's detoxifying, your level of toxicity is greater than your ability or your rate of detoxification, then those substances will be pushed into your interstitial spaces between the cells and can go inside the cells and will just sit there. So you got a poison, let's say arsenic, that's sitting inside your cells doing nothing for decades. And at one point in time, through a process that's going on inside that cell, it interrupts the cap synapse system, which is part of the apoptosis system, and it can block apoptosis, and it could be a cause for cancer. So when you hear about, they did a mouse study and they used charcoal foods, and the animals that ate charcoal foods end up getting cancer, that's the pathway. So that toxin from the charcoal, whether it was a carbon or something, whatever it was, got into the cells and eventually interrupted the cell death cycle and ended up being a cause of cancer. So the scary thing is you could probably read a study on just about every chemical under the sun, and it's probably had a study done that would show to be a cause of cancer. Everything causes cancer. And the truth is everything that you don't get rid of can be a cause of cancer. So you take toxins in your body, then toxins have to get out of your body. And if they're not getting out of your body faster than they're going in your body, then they have to stay in the body. Arsenic has a half-life of probably 15 million years. It's not going anywhere. It's not disappearing into thin air. It's got to either be detoxed into your colon and you deposit it in the toilet, or it's going to stay in your body and it's going to stay in a cell. Now, the truth is that a person could be loaded with toxins and they could still live to 120 because it never interrupted any cell function. That's the scary thing, But, that's the argument. Oh, this isn't poisonous. That it takes so much poison, X amount of moles per milliliter of this to cause death in a human being. Well, yeah, we're not talking about causing instant death, a cytotoxic level. We're talking about what's going to affect cell function that could cause not just cancer, but autoimmune diseases and all sorts of different things that are ailing this country. So it all has to do with my ability to get rid of waste. So what are the limiting factors here? That's the question to ask. What are the limiting factors that I have control over here? Might be a better question to ask, because you don't have control over all the limiting factors. You can eat well. I can start buying organic, and I'm not going to buy any GMO foods. And I'm going to start eating, change my diet and eat really well. Well, I don't care. You're still exposed to tons of toxins. Well, I'm going to only eat, or I'm only going to wear organic cotton. Well, good. That's another step in the right direction. I'm not going to spray my lawn anymore. I'm not going to spray my house for insects. I'm not going to use any more bad chemicals in the lotion that I put on. I'm going to buy only organic shampoo. I'm going to buy soap without sodium lauryl sulfate. I'm going to start using natural, not artificial dishwashing detergent. I'm going to start using natural, laundry detergent. Now you can go on and on and on and on, and I suggest you do all those things. And if you haven't done very many of those things, don't get overwhelmed. It's a process. So making those changes is a process. We didn't make those changes overnight. As we learned about something new, we made the change. Hey, I could go to Target and I could choose to buy 7th generation laundry soap, or I could buy Tide. Well, 7th generation is a little more expensive, but I would rather spend a little bit more money on that and maybe use half as much as I have been using and make it up some other way. You just start making better choices. But even if I made all those choices, even if I did everything right, you're still exposed to toxins. You can run, but you cannot hide. The shirt that I'm wearing right now is a purple shirt. Well, it wasn't dyed with natural dyes. And I have not sought that out to see if that's maybe my next thing to do. But I'm probably not going to do that. So you have some limitations that, okay, I will go so far, but I'm not moving up to the top of the mountain and living as a monk in Tibet. So we live in a real world. So you do what you possibly can do, and then that's all you could do. You got to trust the Lord for the rest of it. But some of the things you can do is reduce your load. That's all I spoke about right now. The other thing you can do is look at the pathways. Look at the pathways. That's what we do the genetics for. So we do the genetics to look at all these different genetic pathways that are going to affect detoxification. We can go on and on here with all these different slides, but all these are the different genetic pathways that are going to affect cellular and liver detoxification pathways. And then if I have genetic SNP defects on any of those pathways, support those pathways. So I can support the detox process. And even at that, it's still not going to be perfect. So, but you do everything you can to support pathways that have genetic SNP defects by exposure levels, trying to be as wise as I can without becoming a guru. And I think that's our best bet. If we could get our rate of detoxification to exceed our toxic intake, then we're at least game positive. The problem is that we might be game positive now that our rate of detoxification is higher than our rate of current toxic load exposure, but for 10 years, this was higher than this. So if my toxic load was higher than my ability to get rid of it for 10 years, then I might have a toxic, holding capacity in my cells that, needs a lot of work to get rid of. So it can be daunting when you're trying to get healthy. My recommendation is always go one step at a time, start making better decisions, do what you can to support these pathways, find out what they are, where I have defects, what I need to support, and then, do what I can to do that. So I know all my detox pathways. That's why we do the genetics. And then try to support those, and then just live your life without being crazy and becoming OCD-ish about it. So I still consume toxins. I like to go to Starbucks now and then. I like to, eat food that isn't always good for me once in a while. I like, I still buy a purple shirt. So don't, become so OCD-ish about this that you're no earthly good to anything. Do make wise choices, and then you ultimately have to leave the results to God. Okay, does that bring up any questions?
Dr. Connor?
Yes.
What are the signs that our bodies will give us if it is detoxing? Is it going to be like loose stools and...
Well, let's be real clear. You are always detoxing or you'd be dead.
Okay.
So what are some signs that you are dumping a lot of toxins? That's really your question, I think.
Yes.
So a sign that you're dumping a lot of toxins could be you could just feel malaise. So you just could feel, oh, I just feel full. I feel you could have, especially on your right side, if your liver is really working hard, you could just feel really full. I mean, on the right side, about a hand's breadth below your nipple is your liver, partly underneath your ribs, and that's a very large organ. And you could just feel full. You could feel just kind of achy there. If you have, could you have diarrhea from doing it? Yeah, that's possible. It depends on what you're dumping. So if you're dumping some like metals and things that might bring with it being combined to make like a magnesium, then it would draw water into your colon and you'd have really loose stools. So those are the kind of signs that you could think of that you're detoxing. Many times people would say, I'm getting a detox reaction, and it might not be a detox reaction. It could be, especially I see with my Lyme patients, they might actually be doing something that's stimulating an immune system reaction, that's creating an autoimmune um, uh, cell death of self cells, and then they feel the same symptoms as a detox reaction. They go, oh, I'm detoxing. Well, those people have to be careful that they're not actually stimulating an immune response that's causing cell death. But for most people with cancer, that's not what you're dealing with. If you get like constipation or diarrhea, you still want to deal with it. You don't want ongoing diarrhea. If you just have loose stools, you can deal with that. Constipation is one of the worst things you can get, and I state that all over our material, because if you're constipated, you're going to reabsorb toxins. So you don't want to be constipated. Especially females don't want to be constipated because one of the first things you'll reabsorb is bad estrogens in the large intestine, and that's not good. Does that answer your question?
Yes, thank you.
Any other questions? Doesn't have to be on detox.
Dr. Khan,
Yep.
can vertigo be a sign of detoxification? I was at the chiropractor yesterday and I had an adjustment.
Yep.
And then now today I have vertigo.
I would question that. So where does vertigo come from? I mean, vertigo is either an issue with the semicircular canals of the middle ear, of the inner ear, or it's some issues with the cerebellum. So is it vertigo upon arising? Is it vertigo upon motion of your head? So if you roll over in bed, things spin a little bit, then they calm down when you stop moving?
Yeah, laying down.
Okay, so if it's if it's, would this describe it? I'm fine if I'm laying there, but if I roll over in bed, oh my gosh, things spin and then they calm down and then I'm fine. And if I move again real abruptly, they can spin and then they calm down and I'm fine. Would that describe it?
Yeah, that's pretty much it.
Okay, that is a semicircular canal problem. So,
Is that Alex?
so in your inner ears, you have 3 canals in each ear that is filled with a fluid. It is lined by this little hair cells called cilia.
Mm-hmm.
And in those cilia, the fluid moves, and the cilia are connected to neurons. And as those cilia move, that tells you where your head is in space. But that fluid in there is extremely viscous. So if I tilt my head to the right now, 45 degrees, and I stop, that fluid moves and then it stops. And that tells a signal to my brain that I moved my head 45 degrees, because it's the lateral semicircular canal that moves, where the fluid moves in. The 3 canals are in 3 different directions for 3 different ranges of motion to cover all 6 ranges of motion of your head and a combination thereof. But if I have a little calcium crystal break off of the side wall of my inner ear, and some people are prone to have these calcium crystals appear. Some people, 99% of people, this will never happen to, but I don't know the percentage, I just made that up. But there's a small percentage of people that have these calcium crystals, and they can break off, and they can go into one of these canals. And then now when you move your head, the calcium crystal's rolling in that canal. So even though the fluid stopped moving, so it's telling your brain, oh, I just rolled over, the crystal is rolling in there, and it's affecting the cilia. So it's telling your brain that you're moving and you're not moving. That is vertigo. So you got a poor communication because of the calcium crystal telling the cilia, telling your brain that you're moving and you're not moving. But then as soon as that crystal stops, then the vertigo goes away. But then I
Right.
move my head again the other way, and the crystal goes, boom, takes off again. It rolls, and it's like, oh my gosh, I'm dizzy. And then it stops rolling. Okay, now it's passed. Okay, it's okay now. So those are called, those little crystals are called otoliths. And maybe this is way more information than anybody wants to know, but sorry. Those otoliths will roll around in there. You have to do a maneuver called Epley's Maneuver, E-P-L-E-Y-S. Look it up, Google it. Epley's Maneuver. You could do this on your own, or you could go to a neurologist or a physical therapist or a chiropractor neurologist who knows how to do this maneuver. To remove, you have to turn your head way far one way, so you could Google it and they show you the maneuver. I've had patients do it themselves with success, and I've had some patients that can't do it. They can't get it. They have to go to somebody to do it on them. But it's a way just to literally try to get that little calcium crystal, that otolith, to roll out of the canal and be out of there. It works very well, and that is the treatment for otoliths. And I had a patient once that had this going on for like 15 years, and at one time doing it took care of her otoliths. And what a miserable existence to be dizzy for 15 years and not have one person know what to do about it. It's not that difficult. So, does that help?
Thank you. Yes, thank you.
You're welcome. Any other questions? Well, I know everybody's dying to know this question. Are the Packers going to win the Super Bowl this year? And of course, sorry, we have to have some levity here, don't we? All right, so are you guys getting anything out of these little calls? Are they helpful?
I look forward to them. Yep.
Sorry.
And here's the other thing too, guys. If you're shy and you don't want to ask a call on here, you can email me your questions. If you don't want to ask a question on here, email me your questions that I can bring up on the call anonymously, and then you won't have to worry about it. Or if you're like, hey, I'm not going to be able to make that call, but I would like this question answered, email me the questions and I'll try to get to them. So like last week, I had some questions. This week, I didn't honestly look to see if I had any questions. But email the Connors Clinic at Gmail, and I'll try to get to your questions too.
Dr. Connor, are you okay if we ask questions on the Facebook page?
Yes. The only no would be the way I receive the feed. It will give me a ding that somebody posted, but then it's like it doesn't come to the top of my feed. So it's like if you posted a question on somebody else's post or on my post 2 weeks ago, it stays down that far on the feed and it doesn't come up to the surface. Maybe I'll ask my Facebook guy if I can change the algorithm to that. I just don't want you to post a question and think I'm ignoring you on there.
Okay.
So if I don't get to it, that's why. Just like yesterday and the day before, there was a couple dings on there that somebody posted something. I thought, who posted? I don't even see. I couldn't figure out who posted something because I didn't see anything new, and it must. So if you don't get an answer from me on there, then that's probably why. But if people have questions about certain things, I don't mind making a video about something because if you have a question, I'll guarantee you 10 other people have that question. So that's a whole purpose of doing this format is the more videos I can make to answer a question, then I don't have to answer it twice and get a sore throat. So that's what we're trying to do. Just I don't know how we'll ever index all of these things, but I'll sick my web guy on, I guess. So any other thoughts? Anything else you need to discuss?
Last thing, Dr. Connors, you might be getting to this, but other than coffee enemas and supplements, do you recommend infrared sauna, and then also would regular sauna be any beneficial?
Good question. So I didn't get to this at all. How do you detox? All I did is allude to supporting the specific pathways. But are there some general things that a person should do to help with detoxing? Yeah. One of the things is some of the things are the things that you talked about. So coffee enemas are a great assist for detoxification. Um, so in your binder again, the castor oil packs are another real good assist. Saunas are really good. I live in Minnesota, so I have to pronounce it the Finnish way because I get yelled at up here. It's a sauna, not a sauna. That's what they yell at me. That's what they say. So in my Minnesota accent, I call it a sauna. So saunas are fantastic. Are infrared saunas better than regular saunas that you're putting water on rocks? Maybe. I'm not completely convinced that they are. So I certainly don't think they're inferior, but I've had patients go, we have the older type rock sauna. Can I still use that instead of an infrared sauna? Oh, absolutely. If you have it, I would just use that. I mean, really the purpose of a sauna is to get you to sweat. And so your organs of detoxification are, every cell is an organ of a detoxification. So we're looking at these genes, a lot of them are cellular genes. Some of them, like the cytochrome P450 pathway, are more liver pathways. So when I show you this picture up here, it's not just the liver that's detoxing, it's all your cells that are detoxing. So when we look at your SOD pathway and your glutathione pathways, these are all in all your cells. So that's what we're trying to support. Intercellular detox, both of those. And plus you're supporting liver pathway. So when you're doing like coffee enemas, then you're supporting the liver. You're doing castor oil packs over the liver, you're supporting the liver. If you're doing saunas, you're supporting everything. You're supporting really intercellular detoxification. So outside of trying to clear out the fluid between the cells, bypassing the liver, which would be a good thing. Take some pressure off the liver. So saunas are really good. And then we didn't talk about it all today, except your question that somebody had before, is the benefit of lymphatic, getting lymph system to move, because that is the way that the spaces between the cells detoxify. So all the cellular functions of SOD and catalase and glutathione and the whole CBS sulfuration pathway are all in every cell. And then they dump their waste ultimately into the spaces between the cell, that intracellular space. And then what drains that? Then you have this open-ended capillary system called your lymph system that is like a storm sewer that then drains that. And then that drains back to the blood, and then that has to go back through the liver, which is the normal process. But if we can bypass the liver so it could drain through the tissues out through sweat glands, then we take a little pressure off the liver. So just using saunas can be real beneficial. The only thing you got to be careful with the saunas, obviously, is when you're sweating, you are losing electrolytes. So making sure you're taking some minerals as well. Does that help?
Yes, someone said that infrared saunas give off EMFs. Is that true?
Well, anything that's electric is going to give off EMFs, and you can certainly get an EMF reader. I pulled mine off the shelf just yesterday because we got into this discussion with the patient, and we were looking at EMFs that come off of computer screens. And computers give off EMFs, but you can measure it. You know, like I'm sitting at a Mac desktop here, and I put it right up to the Apple of the Mac, and it was zinging with EMFs, but you pull back about 4 or 5 inches and it goes down to almost nothing. So it gets dispersed pretty quick. So I don't think that that's a horribly harmful thing. Is the EMFs from that because it gets dispersed pretty quick.
Okay, thank you.
Okay, so our time is pretty much up. I am going to save this and record this, and we will, I'll have it up on the Facebook page and the members only page. If you're on the Facebook page and you're active on it, you don't really need to go on the members only page of the website, though I sent out like a ton of links to patients a couple days ago. So you're welcome to go on it, but it's really the same thing. You don't have the interactive benefit of the Facebook page. The reason why I created the members only page is that we have some patients that say, I don't have Facebook and I'm never getting Facebook. I don't know how to do it. Don't tell me to do it. Then we created the members only. So now I just have to put the things up 2 different places. So that to say, if you're on the Facebook page, stay on that. That's the best way to interact. All right. Please remember to email me questions you have. And if I get enough questions, you know, I'll be doing these more than once a week. So we just want to be here for you and support you in your process and give you every chance to win. God bless. And we'll talk very soon.
Thank you.
All right. Bye-bye, guys.